The Nation's Epidemic, a study of opioid addiction and a proposal for a new rehabilitation strategy, by Crystal Land, Pamela Payne, Kayla Fournier, and Mary Carr for Concord University. The purpose of our study is to develop an improved prevention program by examining several aspects of opioid addiction, compiling past research findings, and utilizing feedback from those familiar with existing rehabilitation programs. Contributing factors are environmental or behavioral influences, post-traumatic events, support systems, income level, and several others that may contribute to drug abuse, dependence, or addiction. Our goal is to increase long-term rehabilitation efficacy by combining findings from the literature with feedback from existing recovery programs. Drug addiction can be defined by a state of being surrendered to something habitually or compulsively, motivated by the possibility of positive or rewarding outcomes, such as a drug high. Drug addiction can also be seen as a disorder. It is characterized by behavioral compulsion and a related problem in self-regulation or impulse control. In other words, the individuals become motivated to seek out and consume drugs at the expense of other activities, despite significant problems arising from their drug abuse. Effects include negative consequences associated with the individual's substance abuse, loss or distancing of the addict's friends and or family, adverse health concerns, and increases in crime and mortality rates within the community. Cadet presents convincing evidence that risk factors for addiction include early and adult life stressors, which may serve as cues that trigger relapses. In adolescence, another risk factor was found in those who had experienced physical or sexual abuse. They had an increased risk of drug dependence. A study conducted in 2015 identified yet another risk factor in female addicts this time, showing that 74.4% of the women had been victims of abuse, with physical and sexual abuse relating to higher levels of addiction severity. Opiates are Schedule II and III controlled substances such as morphine, oxycodone, codeine, hydrocodone, or methadone. Opioid addiction is classified by the Centers for Disease Control as a national health epidemic. Between the years of 1999 and 2010, sales for painkillers by hospitals, doctors, and pharmacies increased fourfold. They also report that in 2008, deaths resulting from painkillers totaled approximately 14,800, more than heroin and cocaine-related deaths combined. It was found that drug abusers use various methods of obtaining these substances, such as doctor shopping, paying with cash, and filling prescriptions in different states to avoid detection. West Virginia has been negatively affected by opiates more than any other state in the country. They experienced the nation's largest increase in drug overdose mortality rates between 1999 and 2004. While examining patterns of abuse among West Virginian pharmaceutical deaths, it was found that being male, less educated, and living below the poverty line were risk factors for opioid abuse. Factors unique to West Virginia are a disproportionate number of manual labor jobs, such as coal mining, timbering, and manufacturing. These jobs leave workers prone to injury. West Virginia also has the second highest unemployment rate. From 2014 to 2015, they lost approximately 19,000 jobs. West Virginia's expert pain management panel, consisting of pain specialists, pharmacists, and health insurance representatives, have recently developed a step-by-step guide to understanding when medical personnel should use opioids to treat pain and when they should use alternative methods. This is known as the neuropathic pain prescribing algorithm. Other alternatives to prescribing pain medications may include surgical intervention, steroidal injections, or physical therapy. Encouraging alternative methods and increasing accessibility decreases the amount of opioids dispensed. Currently, there are many types of drug addiction treatments, including inpatient and outpatient services. According to the National Institute of Health, there are unique needs for several different groups of people, such as adolescents, women, the elderly, or victims of abuse. It is suggested that by asking clients open-ended questions, contextual clues can be used to find treatment options tailored to the client's needs and best interests in order to create a reasonable plan of action that is likely to succeed. A strong support system is essential to rehabilitation efficacy. Including a family member or spouse in an individual's treatment plan can strengthen and extend the treatment benefits. Empathy also plays a big role in addiction recovery, being that it is significantly and positively associated with drug refusal efficacy and prosocial behavior. By examining the successes and failures of various treatment components, we can learn from these to create a more successful program design. To wrap up this presentation, all sources used in the PowerPoint are listed here. The presentation is in alignment with our Foundations of Social Work Practice program concept paper. This has been Crystal Land representing for the rest of my group. Thank you for your time and interest in our social justice issue.